So what is a cervical fusion? Cervical fusion doesn't really address what the complaints of the patient is, and the name doesn't really make too much sense. So this is a normal x-ray. The discs are lining up correctly, the spaces are relatively equal, and the neck is held in a curvature that is natural. In contrast, look at these two x-rays. You can see a normal disc and collapsed disc. The space is much thinner here in this disc as compared to these upper level ones. So what do we do here? This disc is pushing on the spinal cord and also pushing on the nerves that are coming out of the neck. The surgery of fusion is removing the disc, putting some kind of a spacer, reproducing the disc space, and then trying to fuse the bones together because we just took out the disc in between the two bones. Here we can see the intervertebral device or the cage that was removed. You can see how the spacing is much better. Actually, we increased the size compared to this. This is the same disc that the cage was placed, and we elevated the disc space. Now the cage itself is made of a material that is kind of close to plastic, so it doesn't show up on an x-ray. So the manufacturer puts this marker, this metallic marker, and we can see where the implant is sitting. Then we put some screws going through the implants to hold everything together. Inside this cage, we put bone graft, and then we are hoping that it will eventually fuse in this position. Easily you can see how the disc space was elevated. This is called a cervical fusion. One of the most common procedures done, relatively successful, same outcome as a cervical disc replacement, although the indications are different, but this is a relatively successful procedure. The operation is about an hour long. Most patients go home the same day.